Welcome to this very special edition of the KJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have Dawn Wells. She's known as the Wiz of Wellness, and as she says, the only practicing medical fitness practitioner in the US. She's a former Marine and she's an award-winning expert and best-selling author too. She empowers clients to achieve lasting wellness, body, mind, and spirit. Welcome to the show, Dawn.
Welcome. Thank you. Thank you. I'm so excited to be here, AJ. Thank you for having me.
You are welcome. Welcome to the showdown. Welcome to India in this online form. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now. We'll be talking about how one can revolutionize their wellness through science. We'll learn all this from you. But first, Don, let's learn a bit more about you, about your journey, about your background, so that the audience learns a bit more about who they are listening to.
Absolutely. So, yes, like as you said, my name is Dawn Wells. I am currently stationed in the U.S. in Covington, Georgia, right outside of Atlanta, by way of the USVI, which is U.S. Virgin Islands. Have been in healthcare for about 4 years, but in wellness for 13 years. And so I love what I do. I have a passion for it. It's my ministry. It's what I love. Like you said, I'm a former Marine, so it's always been a part of my life. But just like with anyone else, life has caught me. I was bulimic for over 25 years, and so overcame that. And so here I am, and I've applied what I've learned through that and my education to help save lives here.
Absolutely, absolutely, Don. So let me understand a couple of things for the audience first. First, you are known as the Wiz of Wellness. How did that come along in your journey?
It was actually given to me because I am a whiz with wellness. I love to practice unconventional methods of that healing people. And so it was actually given to me by my mentor. So I was like, okay, it works. Because I'm good at coming up with tailoring wellness for each individual because it's a very individualized journey. So that's why he gave me that.
Absolutely, absolutely, and also help us understand about being the only practicing medical fitness practitioner in the US. And this is, help us understand what is this medical fitness. We all know about fitness, but what about medical fitness?
So I'm medically trained. This is a nice way of saying, a fancy way of saying I'm medically trained to treat chronic conditions like diabetes, cancer, high blood pressure, things like that, with utilizing fitness and nutrition. And so the fitness journey and the nutrition journey is very much tailored to your health as opposed to just getting you in shape. So it does that too, but it's more so to heal your body. And in doing that, being medically trained to use fitness and nutrition as medicine allowed me to be able to like understand medications and understand how the chronic conditions work, because not all chronic conditions should be treated the same way, and not all fitness programs are actually best for it. There's like fibromyalgia, for example. You should only be working out to 35% of your capacity. But most trainers, 99% of the trainers in this world don't know that. But I've been trained in that way. So that's the difference between like myself and a personal trainer. I do see patients. Doctors refer their patients to me. And here in the US, I do bill to insurance. But I have online programs for those that are not local to the US as well.
Absolutely. So to be, inform our audience much better, you are not a doctor, but you can prescribe things. How does that work?
So I don't prescribe medicine. I prescribe fitness and nutrition based upon the recommendations that you're absolutely right. I'm not a physician. Based upon the medical notes that I receive from the physician, as well as the referral, it tells me what's going on with a person, just like when you see a physical therapist or any kind of specialist. right? And from there, I will then use fitness and nutrition. I'll prescribe medicine in that way. And the nutrition and the fitness is the medicine.
Okay, so you are in a layman's language, you are a nutritionist as well as a fitness expert, both put together. Am I
Yes,
right?
yes, but in a medical environment. Yes. So the I guess if you wanted to understand more in depth, you could consider me a clinical physiologist and a nutritionist. Yes.
Okay, but why if someone says, how are you the only one? A lot of people must be doing it. How does you it make
Yes.
you the only one? Means that's a bit intriguing.
It is. Medical fitness is not new. It has been practiced since 2009, actually. And there are other medical fitness practitioners. What makes us different from those that just do medical fitness is that we're actually recognized by healthcare. And so we're allowed to bill our services through insurance. And so that's what makes us different than anyone else. In addition to that, we get patients referred to us by physicians as opposed to just someone going to see someone. So while I do have other colleagues that are medical fitness practitioners, I'm the only one that's practicing and utilizing insurance to bill my services.
Right. And does it need any special qualifications for this, Dot?
Yeah, so I did actually go through an intense program of continuing education to become a medical fitness practitioner. The average person would start out with a master's degree and then build upon that. I did not have that. I just had enough education to equate to that.
Right, right. So in a way, a lot of our modern medicine also recognizes about medical fitness and blood-based nutrition to
Yeah.
also treat chronic health conditions, if I understand correctly. In this way, if we look at it.
Yes, it doesn't create yes, modern medicine actually does. Yes, it actually elevates the chronic condition. So it may treat one thing, but it's also going to long term cause other things. And if we don't, so why have that, right? I can understand that in the beginning when somebody's first diagnosed, they may decide to take medication, and it's necessary in a lot of cases, but that is not the means to an end. Kosh, that is
Okay.
just not. And so you should then go back to what we were given from the beginning to utilize to help heal us. Pulling something off a tree or taking it from the ground, right? We get to back to the root of what we're supposed to be doing with our bodies to heal the root causes of these chronic conditions. Does that make sense to you?
Yes, 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 indeed, Don. So let's understand, in a from a couple of perspectives. One is the chronic condition, and
Yes.
that is where you talk about medical fitness and blood-based nutrition. Help us understand, and you also talk about, that why fitness and nutrition should be your first prescription. Why do people miss out on this part? Then they go and take a lot of medicines. Then they also recognize that nutrition and medical fitness is required. Then they are again referred to you. Help us understand this whole chain of things.
Taj is called money. And there is big money in medication, and physicians definitely have a place, and I'm not saying medicine doesn't as well, but we miss the mark on that. We live to eat instead of eating to live. So we miss the mark on the nutrition because at least in the US, we don't learn really what nutrition is. We just learn about food, and the body doesn't understand that. So we just eat what we like, not knowing really what it's doing to our body. It's miseducation. And so that's why most people miss it. And we go to medication because that's all we know. We know to go, we're sick, we go to the doctor gives us medication, right? But he does or she does also tell us to clean up our diets and find and exercise. But that's the part that we miss out on. We learn the higher education before we learn the ABCs when it comes to nutrition and fitness. That's why.
Okay, so we only hear only the part which helps us bring immediate relief and
Yeah,
not the part which is there to benefit us in the long run. That's our problem also. That's
that is,
our problem.
we are instant gratification. Humans are just that way. We want what feels and tastes and looks good immediately.
Immediately. So let's
And
look at, as I said, a couple of perspectives. One is we'll come to the chronic conditions
yes,
first. First, and you talk about medical fitness and blood-based nutrition. Here you have got this blood-based. Help us understand how do we use your methods to and this is a simple method, anyone can do it.
yes, it is very simple. So the blood-based nutrition is not my concept. I actually learned of blood-based nutrition from Dr. Peter Diadamo's Eat Right for Your Blood Type. Um, uh, he's a nutrition science master nutrition scientist. He and his father eh, truly created this concept and have done decades of research. And basically it's common sense if you think about it, Kaj. If I'm a fish, all right, I'm gonna give you a really quick example. If I'm a fish, there's freshwater fish and saltwater fish, right? We don't put freshwater fish in a saltwater environment and expect it to thrive. So if you take out the fish and you think about our bloodstream, and this is just my Dawnism 101, not the actual science that Dr. Diadamo has done. If you take that fish out and put in our blood type A, B, C, D, A, B, A, B, and A, O, and A, B. I'm Russian. All right. And we take that out. Doesn't it make sense? We all need water. We all need the macronutrients, protein, carbs, and fat, right? Just like all fish need water. But doesn't it just make sense that depending upon where your habitat is, what water environment you come from, where you get those macronutrients is going to be very prevalent. It just makes sense, right? I'm not going to go and get my water from a saltwater environment if I'm freshwater. I'm going to get it from me. So, for instance, a type O blood thrives in a meat-based diet, right? Getting our protein from meat. A type A thrives with getting our protein from plant-based, all right, or even fish. And so it just says that. Now the science behind it, which is very simple, is basically it has to do with the lectin in the food and how it makes your blood clump. If you have too much clumping in your blood, it's called agglutination. It's going to create inflammation. Inflammation causes chronic conditions and the downward cycle. That it's very, very simple. It really is. So it's just being able to know what foods are best for your blood type and understanding what macronutrients are going to be healing and not healing. Not saying that they're not all healthy, right? But it's prevalent to what's best for you. And that's what I've incorporated into my wellness program, along with the medical fitness, because a lot of us are already sick, right? Not me, not you, but a lot of people are already physically sick. So we still have to treat that on top of getting them back to the root understanding and healing that. Does that make sense?
Yes, Don. So let me understand it again this way.
Yes.
You see, when God created us in different blood types, which we are trying to, a new, if I understand, a new blood type was again discovered very recently, and more we are coming
Yes.
to know about our thing. When
Yes.
God created us in different blood types, He obviously didn't know that one day we will develop a medical science. He has created those things within our own. Why
Hey,
is it? Why is it then that some people may not like a few things, but why don't we only crave for those things as per our blood type? Why do we crave for all the not so good things? And every blood type craves for those things. We should naturally be craving for only those things as per our blood types. Why
we
this anomaly? How does this
we
happen?
it's because of this thing we said in the beginning. Well, not honestly, our bodies, because we eat the things that are not right for us, we've also evolved with food. When God created us, there was only, everything was natural, right? Over time, they've made potato chips and fried foods. They didn't have that. So our bodies started to crave those things because we were exposed to them. And as we crave those things, more of those things were created. And it also creates a deficit in our nutrition. So the body still needs what it needs, but we give it all the sugar and all the fat. And when we do that, it now is going to continue to crave it. That has nothing to do with God. That's everything to do with man, and how we have decided we're going to use choice, because God did give us freedom of choice, right? And science, to make other things that are not good for us. And then we overindulge in it. Not to say you can't have it sometimes, but as humans, we overindulge. And that's why we crave it. It's not because God has designed us that way. It is because of what we've exposed ourselves to. But I love what you said. I love it. He gave us
Thank
what
you.
we need, but we do what we want.
Absolutely. But the good part is, that uh, doctors themselves are sending patients so that they can get the benefit out of, either because of side effects, or they know that, okay, the medicines part is over. Now let them look at their holistic
Yes.
health in that sense. That
And
part is good. The
yes,
second part
very
I
good.
see is that the insurance companies are also acknowledging this part, if I understand it correctly.
You are understanding correctly. Physicians are just learning what medical fitness is, number one. So, what has been happening is patients will come to me, tell me their situation, and I'll tell them about medical fitness. They then go back to their physician, and the physician realizes, oh, this is really good, and then refer them. And yes, we are able to bill under therapeutic services to the insurance. So we're getting the insurance more acclimated to medical fitness. They're not 100% there, but we're getting there. There's research being done by a company called Vitala out of Sweden right now to prove the impacts of medical fitness on nutrition. And through organizations like Healthy Fit, who I actually did my credentialing through, that have created the actual structure for medical fitness to be able to be tackled by healthcare. So it's getting there, Kaj. It's slow, but it's getting there. But yes, physicians are starting to say, okay, this is a good thing. And they're seeing medications being reduced. I have patients that I have a patient, one in particular, he's been on medication for decades for diabetes. Within 3 weeks of being with me, he was able to reduce that. Now we've been on the program for 3 months, and his physician told him to cut his insulin in half and stop it. And he was taken off of high blood pressure medication. Decades now, Kaj. In only 3 months, we were able to do that.
Right. So this is a good example. How did you do it? What was the process, so that
So,
people
yes.
understand what process they have to go through?
Yes. So when a physician sends someone to me, I'm able to look at their health records and what the physician says that they have, and then by understanding what happens to your body with each chronic condition, I'll decide, okay, we need to do a metabolic fitness program of X, Y, and Z. Okay. And there are certain programs that are proven based upon the health condition that is best for you. So I'll prescribe that, and then we work together. Then with the nutrition, I look at their lifestyle and determine, okay, this is what you're currently doing. Let's make some adjustments to that. So I don't do diets, right? I prescribe based upon the blood type and the amounts that they specifically need. But in my online programs, it's more generalized, but still tailored based upon what their health condition is. So they still have to give me some sort of information, but I'm able to treat them. And it's a self-driven program. I give them what they need, the nutrition, and they're able to go off on their own and then do it and just do weekly check-ins. Did that answer your question?
Yes, yes, Don. So a lot of talk is nowadays about functional food, functional medicine. Is
That's
it similar to that, or is there a difference? Help us
is
understand.
right there is functional medicine. It is a form of functional medicine. Yes, absolutely. Yes. It used to be called natural medicine and now they've just evolved because it is. It deals with functional fitness and it deals with functional nutrition. That's spot on. I just tweaked it a little bit and took from the theories that I've learned through the medical fitness program and then Dr. Peter Diadamo's teachings on blood-based nutrition. And I just took it a step further. But yes, it is functional medicine 1000%.
Right, right. So, Don, should people also understand that what our medical science tells that they need these certain conditions or chronic condition can only be managed or has to be managed in the long term. Medical science itself is trying to now understand things better, and it's dawning on them that it's dawning on them that you need to there are things which which can be cured, and does not look at it from the prism of only managing things. And this is more and more obvious or coming across to people. Help us understand this whole change in thought process, and it is a welcome change, because body perhaps only knows about curing. It does not know much about managing things. It knows only about curing.
That's it. Though, Kaj, that was modern medicine, or not modern medicine. That is functional medicine in its finest. That's exactly what we're saying. The body is not designed to manage sickness. Who wants to keep? I mean, if somebody gives me something that's bad for me, I don't want to keep it. I'm going to get rid of it, right? And we just have to get back to the basics, the ABCs of nutrition and the ABCs of fitness. Like even with that, people doing all these crazy, CrossFits and stuff like that. And it's not bad, but you have to be conditioned to do certain things. You just can't get off the couch and jump right into it because it creates more damage. So we have to learn as a people to get back to the basics and do what's easy. Do the basics first. Heal yourself with what God gave us to use, which is nutrition and fitness. And that's it. And get off the meds long term. Yeah, because long term, you're just going to create more stuff.
Absolutely, absolutely. Now let me talk about chronic conditions. In medical science also, they say prevention is better than cure. What about the prevention part? How does your based, fitness, medical fitness and blood-based nutrition helps us in prevention of anything that might be detrimental for us?
Prevention, you wouldn't even need medical fitness or medical nutrition if you were doing prevention in the beginning. The prevention is the basics. Start out with eating the things that God gave us, the things that are natural, right? Even if you're eating meat, get back to the purest kind of meat that you can get, farm raised animals, right? Getting away from GMO eating and things like that. It's going back to the basics. You're absolutely right. You've said everything in a nutshell. Like I'm wordless actually, because it's just getting back to what we started with from the very beginning and understanding that everything that you see is not good for you and just and applying that. But you wouldn't need medical fitness or medical nutrition if you were practicing prevention from the beginning. Change your diet. Yeah, it's not, and guess what, Kaj? It's not hard. It really is not hard. It's so simple because once you start to give your body the things that it really needs, it won't crave the bad foods anymore.
Absolutely, won't crave the bad food
The sugar
anymore. So, absolutely. What about the ongoing situations? People who are experiencing life, whether with less fitness, more fitness, eating whatever they want to be, or not eating whatever is good or bad for them. How should they look at this whole thing called blood-based nutrition, medical fitness. How do they get into better shape or sizes in every form that is possible?
Yes, start again. Evaluate what you're eating. We all know as a society now what's bad and good. We know it, right? And we also know by all of the commercials, everything that's put out in news and media, we know what we should be doing and not doing. Looking at that, and I'm not even saying 100% of the time, 80% of the time, you look at what you're eating and think about, what is this doing for me? What are you drinking? What is this actually doing for my body? Because it does something internally. We're not going to put gasoline in our oil tank in the car. We're not going to put oil in our gasoline tank. We won't do that because we know the car will stop running. The body is the same way. If you know what you're putting in it is not going to, you're putting oil in your gas tank and you're putting gas in your engine, your oil tank, you're going to explode or you're going to stop working. Change what you're eating just a little. Start small. It doesn't have to be all at once, and reduce the things that we're eating that are not right for us, and just start to walk. If you're not active at all, just start walking. Park further away from the store when you go grocery shopping. Little things like that. Very simple.
Absolutely. Absolutely. Simple things are sometimes difficult. Yes, yes, indeed, indeed, Don. Very simple things are indeed sometimes very difficult to do. That's the way life is, you see. That's the way life is. There is much to learn from you, Don, that it takes about all these things. And the most, as they say, the taste of the pudding lies in its eating. The taste of good fitness lies in your blood type and your medical fitness, nutrition and all. So maybe a lot of
small. But that's why you start small. You don't try to conquer it all. And I wouldn't even say conquer it all at once, Kaj. I would say start with your nutrition first. Just start reducing.
Absolutely. Absolutely. So a lot of people who would want to connect with you, learn more about you. You are part of Angel Eyes Fitness, GWF Wellness, all these places. People want to connect with you, learn more from you, about you, get your help in whatever way they can be fitter, better. What's the best way for them to do this?
Find me on social media. Honestly, I have a website. Everything is DWF Wellness. Everything. DWF Wellness. Everything on all the socials, my website, my everything. I own a wellness center. Brick and mortar is DWF. So if you want to find me, it's right on my shirt. DWF for the recording. DWF Wellness. Just look that up and you'll find me. And we'll get you straight. And you don't need to be US based, I want to add.
So anyone from anywhere across the world can connect with you and get your help.
Anyone from around the world. And you'll find that my programs are extremely reasonable as far as pricing. Very affordable. If you're not local and we can't bill insurance, it's very affordable.
Wonderful. Wonderful. So Don, I can only say one thing, once a Marine, always a Marine, always a fighter. It is just that a front and frontiers change. The fight goes on. With this, it's a wrap on this very special edition of the KJ Masterclass Live. Thank you so much indeed for joining us.
Thank you, KJ. I've had a wonderful time.